Hello and welcome back to another episode of the Aurum Meridian. I'm your host, Robert Hawkins. I'm your guide to dental excellence, hopefully. You might say I'm your coach. I might be your quarterback in this situation as well, too. And my guest today, incredible guest. I'm really excited for this one. Dr. Chad Kasperowski, welcome.
Hey, thanks for having me, Robert. Really happy to be here.
There's so much talk, especially as we do this with World Cup going on about, performance, oral health, in the moment performance recovery. And, give me a little bit about your background, sort of the high level overview of your journey from where you started to where you are now working with, professional athletes and how you got there. Because it feels like for most dentists who are sports fans, that's kind of a dream spot to be in.
Yeah, it's a pretty cool gig. I'm not going to lie. I'm a practicing general dentist. I've been practicing since 2002. Started up in Massachusetts, ended up down in Virginia, probably around 2006 timeframe, and it's a little around 2009 when I actually joined up with the team. And this is a popular question that most people ask me: is how did I actually become the team dentist for the Washington Commanders? And the short answer is I worked in the office with the team dentist at the time. And so, I was purchasing the practice rather. And what people don't realize is that when you work with a professional sports team, if an athlete or a coach or anybody associated with the team needs to be seen for any type of dental related thing, and typically it's something either broken or something's hurting, they really want to be seen about 5 minutes ago. And so the reality is that when we'd have players and coaches reaching out to the office and say, "Hey, listen, we got to get in and see somebody," I was actually the one seeing the players and the coaches, not necessarily the team dentist, because my
Right.
schedule I was new, right? And just like anybody who starts off in a new practice, like your schedule isn't completely chock full. And so I had the space and availability. And so I was the one really kind of dealing with the players, and one of the things about professional athletes as well is time. And we may get into this
Mhm.
a bit later, but they have a very busy schedule between training, recovery, getting their sleep, travel, the actual games and practices, what have you. Um, it's really hard for them sometimes to get in. And so, my training from through my residency program in San Antonio, I did a lot of surgical. I do IV sedation. You'd be surprised how
Right.
many athletes are actually really afraid of going to the dentist. It's a big
Mhm.
problem. And I do, basically all the procedures in-house in one spot. And so it's a really convenience thing as well. And so what ended up happening really was the team dentist prior to myself, had some health issues, had to retire from the practice of dentistry. And so the team basically came and said, "Hey, who are we going to find?" And he basically said, "Why don't you just take the guy that's been seeing your players and your coaches all along?" And so that really is kind of how I fell into it. Now, that was not a small undertaking for me. I mean, I took the responsibility in a very big way. And to be honest with you, it's really kind of driven me to be the best that I can be. I feel like I'm responsible to the team, not just, just to be there, in case something breaks, but I want to be a team member. I want to be part of the medical staff, a contributing member. And so that's kind of the origin story for me. More recently, I've really been getting into a lot of wellness dentistry. And
Mhm.
so just not looking at the teeth, but looking at the overall impact of oral health on,
Yeah.
the overall systemic health. And so, it was a pretty easy transition for me to start questioning and kind of looking at, all right, well, we have cardiologists and we have orthopedic surgeons who basically will say, "Listen, I'm going to send a patient to you for dental clearance before I even touch them." And so it's pretty clear that they already understand, our medical community understands that, something going on in the mouth can have a systemic impact. So
Mhm.
my thinking was, okay, well, maybe this can actually have an impact on sports performance and recovery. It's a quick story. I have a son who's a runner. He runs D1 track and field, distance track and field at Virginia Tech. And, my wife and I see him all the time. I mean, he is hyper, focus on nutrition and his sleep. I mean, he wears things like he got me into a Whoop band here. So he wears all these wearable technology.
Mhm.
He probably knows more about supplements than, most nutritionists do. And, just kind of looking at him and looking at every single edge he was trying to get in order to maximize his performance, I started thinking, well, what about elite athletes? I mean, when you start thinking about elite athletes at the elite level, I mean, the difference between winning and losing is so small. You look at, track athletes that run in the Olympics, for example, the 1500 meter, men's race past Olympics, right? I think it was like a hundredth of a second. That was the difference between a gold medal and a silver medal.
Hmm.
A small thing, right? But if you think about these guys who are training for so long
Yeah.
and they've had one race, and I mean, they literally run around that track and are doing a mile in under like 3 minutes, 45 seconds. I mean, the difference between winning and losing, being remembered versus forgotten is such a small little thing. And so I started thinking, like, what kind of impact can an acute inflammatory response, inflammatory reaction going on in the mouth, what kind of systemic impact can that have? And is there a performance liability that's associated with it?
It's so interesting to hear you say that as at the professional level, how such small improvements, tweaks in any way, their whole body, their oral health are have such a giant, incredible impact. Like I saw a clip from Formula One the other day. It was Nico Rosberg talking about how 1 kilogram of weight off of the car is basically the equivalent to like one hundredth of a second in lap time. Those guys are racing to that, if not to the thousands. And he gave an example of one race where he shed a whole bunch of weight, cut holes in his seat, used a different type of paint on his helmet to bring the weight down, and that the difference in his qualifying between first and second was like the math lined up exactly, and he ended up winning the race. So, do you have any specific examples of um, from an oral health perspective, the things that they're doing for preventative performance and recovery?
Well, I think right now, I mean, that's sort of the big gap that we're looking because there really isn't a ton of stuff that's being done currently. I mean, people are looking at it, but like when you start looking, digging through the research, there isn't really a ton of research that's being done specifically about oral health and its impact on sports performance and recovery. There's a ton of research out there about oral inflammation and systemic inflammation. And at the same time, there's a whole bunch of information out there in research, I mean, tons about systemic inflammation and its impact on sports performance and
Right.
recovery. And we probably get to that a little bit, sort of the mechanisms behind it.
Hmm.
But if you kind of take those two things, which is just a huge body of evidence out there, and then sort of try to connect them to it, like it's like a connecting of the dots, basically. But no one's really kind of looked into that. And that's sort of where I'm fitting in. This is my interest now, is trying to figure out like how do those dots actually connect and what type of measurable impact can we actually make? And it's my general sense that there's a huge benefit that could potentially be made, as far as sports performance is concerned, including recovery. And it may literally just be right underneath our noses.
And so I think one of the things you mentioned was systemic sort of inflammation in the body as well too. Going
Mhm.
through any kind of, maybe it's a regular hygiene appointment or a dental, any kind of procedure, restorative procedure, placing implants if they've got trauma, or they're just probing, whatever it may be. How does that affect inflammation in the body, in the mouth and the rest of the body? And then how does that affect when they're in a very strict training regimen? How do you handle that process?
Right. So that's a great question, Robert. I think in order to answer that, we first need to understand what is inflammation, right? So everyone thinks inflammation is this terrible thing. We don't want inflammation. The reality is that when we exercise, our body experiences a huge inflammatory response. So in general, what happens is when you start, working out in your gym or you're, out in the soccer pitch, I'm going to use that example because the World Cup's around, but as your muscles contract, they release something called IL-6, which is a pro-inflammatory cytokine. It's a messenger that kind of travels through your bloodstream. And there's a huge benefit for that. I mean, the number one thing that it does, it goes to your liver and it releases glycogen stores, which essentially is your energy source. So if you want to keep exercising, you need the energy source. So it mobilizes that into your bloodstream and makes the muscles able to absorb it so they can continue working. The other thing that it does is actually initiates an inflammatory response in something called macrophages. So macrophages are cells that are generally found throughout the body and all the tissues, muscles, what have you. And what happens is IL-6 that's floating around stimulates these to release more pro-inflammatory cytokines, things like TNF alpha and IL-1 beta. So it's important to understand that these things are there for a purpose. So, when you exercise, these pro-inflammatory cytokines are basically there to clean up the mess, if you will, damaged muscles, damaged tendons, things of that nature. And then what ends up happening is when you're done exercising, that wave of IL-6 disappears. That trigger, that environmental trigger for more inflammatory cytokines no longer exists. And all of a sudden now there's a conversion of these macrophages, these cells from an M1 pro-inflammatory type to something called M2 or a pro-repair type macrophage. And so that concept's called macrophage polarization. And when you start looking at athletes, when they are training, the whole point is to try to get that transition to go from pro-inflammatory to pro-repair as quickly as possible.
Okay.
And so it really kind of depends on sort of the environment, the local environment of how these macrophages respond, right? And so when you
Hmm.
start looking at, things that athletes do, I mean, I can speak, about our team, for example. We have red light therapy beds, $250,000 a piece, which is supposed to be anti-inflammatory. We have cryo chambers, nitrogen-free cryo chambers, hyperbaric oxygen chambers, each of those probably at $250,000. We have cold plunges and there's a team nutritionist and we have our own chef and own kitchen, anti-inflammatory nutrition, right? Supplements, all these types of things. It's about getting rid of the inflammation. So the problem is that in the mouth, especially things like periodontal disease, the gum tissue is so vascularized in normal inflammatory response, you get a leakiness in the blood vessels. And so all the bacteria, especially the higher inflammatory kinds that you can see sometimes that are especially athletes are especially susceptible to, they basically now get and spill over into the bloodstream and they circulate through the body. And this now is your new low grade environment, right? So if you have these pro-inflammatory cytokines, the same ones we talked about, IL-1, TNF alpha, IL-6, coming from your mouth, not from your muscles now, it just basically becomes this pro-inflammatory low-grade soup that inhibits that transition from M1 to M2. And so, training thresholds sometimes are lowered because of that, or at least that's what we suspect. But I can tell you that, with our training staff, there's a concept called the elite athlete paradox, which essentially is overtraining. And even if you just exercise too much, and so, say you went out for a hike and you just kept hiking and kept hiking and kept hiking, your body never is able to transition to reparative mode. And eventually you're just going to start working again. So you're actually going to start eating away at muscle tissue and,
Mm.
and stuff like that. So,
Right.
training staffs are acutely aware of where that point is and how do they measure it? Well, watching the athlete, seeing how they perform, all these different measurables, things like HRV, blood tests, CRP, you can do inflammatory blood tests basically that mark and show you how much inflammation is present. Um, so anyways, there's this fine line that you want to train up to that threshold as much as possible, but you don't want to go over it.
Mhm.
And one way of going over it is if you already have this low-grade chronic soup of cytokines floating around, inflammatory cytokines. And it's not
Mhm.
just periodontal disease, it's things like pericorditis. So, a lot of our players just still have wisdom teeth. So that's just a focal source of inflammation, in the same way that periodontal disease is, it's from gum tissue. There's a lot of research out talking about root canals. Just because our athletes are the most optimized humans on the planet, that still have lots of dental issues. The surprising fact is, and you see this not just in the NFL, but you see this in European soccer, all kinds of sports. I mean, a lot of these athletes come from underserved areas. They may not
Yeah.
have access to dental care growing up. They may not have the wherewithal that, to be able to afford dental care. They're afraid of it oftentimes, which is crazy, but there's an avoidance pattern there. So, there's a lot more dental disease in these optimized athletes. And so, you start to see this and you start to kind of think, okay, well, there's obviously this focal source of inflammation. Like, what kind of impact it's going to have? And we haven't even talked about sleep issues, right? Because if you're not getting a good night's sleep, there's pro-inflammatory issues there. You're not getting your deep orient like REM sleep, which is the biggest part of your recovery, where your growth factors are released and things of that nature. Um, and look at our players. I mean, they're on airplanes, traveling to different hotels, sleeping in different beds. Sometimes their games are at night, sometimes their games are in the morning. Sometimes it's like, they have to be on airplanes. And I can tell you with 100% certainty that, you have an offensive lineman, they're not sitting up front in first class. They're in coach seats, just like everybody else, stuffed in the coach
Okay.
seats. So, even on the flight home, they're not getting restful sleep. And so it's a struggle. I mean, they have, family tugging at their heels. There's media and there's, like, everybody is kind of like wanting a little piece of them, right? So, So that's a huge factor for these athletes as well. So they're not getting the recovery. There's a lot of inflammation. And, as dentists, we're well trained to be able to spot some of these, potential signs. We can't diagnose sleep disorder breathing. We can identify signs of it. High vaulted palates, grinding of the teeth, erosion, scallop borders of the tongue, just looking at facial features. I mean, there's apps now that you can actually show, just have like look at your iPhone and it'll kind of give you a good idea if you're higher risk for sleep apnea or not. And
Yeah.
bottom line is teams do a lot. They do everything they possibly can. They do not, spare a dime trying to get any type of competitive edge through anti-inflammatory meetings. However, it just really doesn't seem like there's been a huge emphasis on oral health up to this point. And I can tell you again, because I've been doing this for 17 years with their team, that in general, it's more of a reactive approach and not necessarily a proactive approach. And that's what I'm trying to change.
So why would you say, I mean, what an incredible answer. There's so much that I want to follow up on. First of
Mhm.
all, chronic inflammatory soup sounds a really disgusting term. How do you manage that? And then I guess my other question would be, are there different considerations in managing their oral health when they're traveling so much on a plane in different environments, things like that? Um, Maybe that's a dumb question, but I'm going to ask it anyways because somebody else might be thinking it. So I guess that is my question. Different considerations because you've got dry, humid conditions. They're not sleeping well. Are a lot of those things like exacerbated, or is it purely just due to their own genetic disposition?
Well, first of all, I think, and I think I alluded to this before, professional athletes are at higher risk for oral disease than your normal population. Why is that? First off, you when you're an athlete, the amount of carbs that you have to consume is unreal. I mean, they're out of practice and it's constant like Gatorades and electrolytes and all kinds of
Hmm.
stuff. I'm constantly eating. And in the dental world as dentists, we know the what's called the Stefan curve, right? Which kind of shows every single time you put something in your mouth, you have this, acidic environment that's created. Your body's trying to digest food. But if you can
Hmm.
imagine just doing that all day long, right? On top of that, they're typically dehydrated, so they lose a little bit of their salivary flow. So they don't have the protective effect that their saliva would normally do, not just the bacteria, but also the acids and protection against the erosion. And then on top of that, they're doing a lot of mouth breathing. We talk a lot about the importance of nasal breathing, things like nitric oxide production, that kind of stuff, right? As an athlete, I mean, there's only a certain point where you can breathe through your nose, but then you have to literally start breathing through your mouth, right? And so just constantly drying their mouth out, right? And when you have a dry mouth, it creates more acidity, which is, more in tune to the bad kind of bacteria that you don't want to have versus the good kind of bacteria. And you don't get the washing away of those acids like I was talking about. And so, in general, their lifestyle is such that they're a little bit higher risk for things like, periodontal disease and oral inflammation.
So for a high performance athlete, whether it's an NFL player, whether it's a D1 runner who's giving, has a high heart rate, breathing a lot in their training, what does their hygiene routine look like? How frequently are you treating them? And does that hygiene appointment look any different from not the pros, but the Joes?
Well, I mean, their hygiene visits look just like anybody else's hygiene visits. Part of treating somebody is being able to diagnose. So when an athlete or any patient comes into our practice, for example, we will always do microscope slides. So we'll take a little swab of their saliva and look at, it's a
Mhm.
screening. It's not an actual test, but we can see, do they have higher risks types bacteria or do they have the lower risk type stuff? If there's higher risk, we can do things like oral DNA testing, which will now quantify the exact type of bacteria
Right.
and sort of the rough levels of how much they have in their mouth. We can do things like alpha metallometrix proteinase 8, which is a newer biomarker. Basically, it's released by your gum tissue when collagen is breaking down, which is sort of a marker for periodontal disease. And so that's a chairside test. You just do a saliva test and you can kind of get a little bit of a number there. Now there's certain instances where that can be thrown off a little bit. So you got to be careful. You obviously can't just go off of one result, but you have to look at everything in total. But after that, it's really about, training. I mean, I think, back to your question about traveling, like, do we have to do anything different? Well, they may drink a little bit more water after they have their, electrolyte Gatorades or whatever it is that they're drinking. But the normal, the basics, the fundamentals that we basically tell everybody that walks in our office, brushing twice a day, flossing, getting underneath the gums, really just kind of changing the environment in your mouth so that it's more suitable for the good style of bacteria that you want. And part of that actually is not using high alcohol containing mouth rinses, things like Listerine and Scope and that kind of stuff. I mean, they're great for what they do, but the problem is they kill all the bacteria,
Hmm.
the bad kind, but also the good kind. And so we talked about this commensal bacteria, the good kind of bacteria that exists on the back of your tongue. But this is
Right.
the bacteria that actually is responsible for helping to create nitric oxide in your body. So it doesn't necessarily create it itself, but what ends up happening if you have leafy greens, like spinach and leafy green vegetables, beets, things of that nature, the nitrates from those foods get converted into nitrites by these certain types of bacteria. And then you swallow that, and then your stomach, the nitrites get converted to nitric oxide, which gets absorbed by your stomach, circulates through your body, actually ends up back in your salivary glands. But nitric oxide is hugely responsible for vasodilation, so lowering blood pressure. But it helps to like basically increase blood flow to repairing tissues, which is super important for a recovering athlete. It
Right.
also helps in oxygen utilization. There's some studies out there that show that if you have a lot more nitric oxide present in your system, you actually have a higher VO2 max, right? And you can sustain, a certain level of performance higher than the athlete next door. And um, so all these things that we normally do for our athletes when patients come into our office, we also do for anybody because they're all high performers. They might be high performing moms. They might be CEOs
Right.
of companies. I mean, there really is no difference. Yeah, our athletes are focused on one particular thing, but when you really think about it, it's not just long-term health and longevity that we're looking at, but we're looking at the current performance that they're doing as well.
Yeah. Yeah. I mean, that's so incredibly important. Basically, what you're saying to sum that all up is you want to, like Fast and Furious, you want to put a NOS bottle inside them to make them go faster, increase their VO2 to their engine, right? So, um, what would be some of the,
That's a funny analogy, by the
yeah.
way.
And I mean, I grew up watching those movies, right? So you got
Yeah, yeah,
NOS,
yeah,
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 hit the
yeah,
button, mash the button. Where's the NOS button? Yeah. Um,
yeah.
what
I
would you
think that was
say?
I think that was in my Super Mario Brothers game as well, and so
Yeah, yeah, that's true. Yeah, same.
Mhm.
Uh, so what would you say are kind of like some of the highest ROI things that you can do to improve your performance via oral health? Like, are there procedures, I mean, other than the salivary test, like, are there certain, I don't know, is it a certain bite that you're putting them into? Is a certain, airway metrics that you're looking at to help them maximize their VO2 output? Like, what would you say are some of those things you can do?
well, that type of performance stuff really is the responsibility of the training staff, like the sports performance training staff. Really what we're trying to do is not take over. Like I don't want to come out and oversell what we're as dentists are doing. I don't want to say, hey, if I do scaling and root planing, you're not going to get a pulled hamstring or you're not going to tear your Achilles tendon this year. That's not what I'm saying at all. And I think
Hmm.
it's really important to kind of keep that in mind is that what we're really talking about is, trying to, manage a manageable, modifiable source of information in the mouth. And so my
Right.
answer to your question really is start with the basics, right? I mean, our normal brushing and flossing, teach them how to, consume foods, when to consume foods, if possible. Certainly see the dentist, right? A lot of these guys, I can tell you, I mean, some of the players, you ask them like, when was the last time you've been to the dentist? Like, well, elementary school. Like it's alarming and so how
Yeah.
infrequent some of these players go. And again, no judgment at all. I mean, they're just super busy
Yeah.
with their schedules and everything else. So what I would say is that, that visit to your dentist, especially one who knows what to look for, things that we talked about before, doing the salivary testing, looking for airway issues, knowing how to diagnose and treat periodontal disease, using adjuncts like ozone, for example, that can really kill bacteria, disinfect, and really get them back into a healthy state quicker. I mean, all this type of stuff you want to be able, if you can find a dentist that can provide that, and also is able to speak the language of a sports medicine team. They don't necessarily understand, MO fillings and, scaling root planings, but they do understand inflammation, right?
Hmm.
And we can kind of speak on the terms and the words and the verbiage that they use, then we can kind of integrate and be able to, do that quick handoff with our players a lot more frequently, communicate much better. And so I would say stuff like that, certainly doing the sleep screening, speaking with our sleep colleagues if we suspect there
Mm,
might be something going on, because they're the ones that would take the reins and really make the diagnosis on that. Certainly, if there is a positive finding there of sleep disorder breathing, again, dentists, we're in a prime spot to be able to treat. You have a player that's traveling, they're most likely not going to want to carry along their CPAP machine if that's what they've been prescribed. And so, an alternative obviously is an oral appliance,
mhm.
and that can easily fit right in their backpack and their, however they're traveling. And so it's very portable. And so it makes a lot of sense for an athlete who's on the road all the time. Back to your question about, jaw position, making appliances that can help players
Mhm.
perform. The jury's out on that. I do know quite a few people who are involved in research on that front.
Yeah.
A lot of it has to do with balance, balancing the muscles, balancing the jaw. And the idea is that it kind of helps to balance the rest of the body. And there are some studies out there that do kind of what you alluded to before, talk about like if you put a certain mouth guard in and if you clench at the exact amount of time, right when you're going to go ahead and push the weight up, you might be able to get a marginal increase in the amount of weight that you can lift. The problem with team sports like football is that you can't really put them into that position. It's an unsafe position. And they're talking, they're running, things are moving around. And so for them to actually remain in that precise position and be able to do all those things that the study requires, is really just not, it's there's no real utility in it, at least right now that I can see. Now, is there a time that we might be able to see some increase? I don't know. The jury's still out on that. But I think the bigger bang for the buck by a long shot is what we've been talking about already, which is the modifiable inflammatory source, which we already know has an impact on the systemic inflammation, which, sort of by extension, likely will have an impact on their performance and recovery.
Mhm. Have you played at all with a lot of these sort of tech wearables that are coming out intraorally as well too? I know there's some mouth guards. There's even some um, night guards as well too, that have the sensors built into them, so they're managing looking at clenching, bruxism, things like that. Have
Mhm.
you tested any of those on any, aside from the NFL, but any of your patients, and what are your thoughts with those?
So I have not tested much of the wearables at this point. I do know about them. I want to say the European Rugby League, I know they now mandate mouth guards with the accelerometers. So really what they're trying to just gather data to see, okay, this particular player took this type of acceleration type hit, a rotational hit, or wherever it is. And they can then take that data and cross-reference it with the clinical data where, hey, this person's been diagnosed with a concussion. And the whole goal there is really to see, is there some threshold that we can come up with that would say, all right, I'm sitting on the sideline, player A just took a certain type of hit that's over the threshold of what we normally would see a concussion. Even though they may not be showing signs of it on the field, we should take them out and do an assessment. I think that makes great sense. I know the NFL behind the scenes is looking into this as well. Concussions are a huge issue in the
Yeah,
NFL, as you know. And so, as far as some of these other bruxism type appliances, again, I'm not so sure how much utility there is. I mean, if you're doing a sleep study, oftentimes there's EMGs that are on the muscle, so you can see if there's some grinding.
right.
So does it make more sense to incorporate that into a mouth guard already? The other thing I can tell you, and this again is my experience 17 years with a team, is these guys chew these things like crazy. And I will tell you that anything electronic or wearable goes in the mouth
Yeah.
is not going to stand the test of time for very long. It just is not
Mm,
going to. And so, the expense and the effort to try to do stuff like that, I don't think it's there just yet. But I do think there's a future for it, for sure. Just like everything else. I mean, sports performance is really about the metrics, biomarkers. It's about things like wearables and real-time data. I mean, picture an athlete where you can see that all of a sudden they're becoming dehydrated, like in real time on the field. And so, hey, you got to come off, take a sip of this, like some electrolytes, or maybe get an IV started, versus waiting for them to cramp up and now they're out of the game, right? So this is now the same idea that I've been preaching with the oral health piece is we're being proactive and not necessarily reactive in the
yeah,
way that.
yeah. Uh, Talk to me about your experience with adopting or patient adoption of mouth guards at the amateur level. And especially if we look at sort of the teens who are in maybe mixed dentition, I know for us historically, that's been a challenge. You know, they don't like it. It's too bulky. It's not the right color. It's not cool. Tell me how you manage that conversations with patients, and also the challenge for us as a laboratory, because we do custom sports guards for professionals as well, has always been, well, I can go to the local sporting store and I can buy one from Nike, Under Armour, whatever for $50. Why don't I just buy that one? So tell me a little bit about that, and why that maybe is a good idea, but ultimately there's better options.
Sure. So first off, I've put a lot of effort into researching mouth guards. Like I really strongly feel that, especially in the youth sports, I think everybody should be wearing sports guards. And the reason is this, all it takes is one accident to a front tooth, and you're now dealing with a very expensive lifetime of issues, and not just monetary. It's going to be, confidence, self-esteem,
Yeah.
that kind of. So, with that said, at this professional level, there's only, I think it's MMA boxing and professional boxing right now. And then if you go overseas to rugby, those are the only professional sports that actually mandate mouth guards, believe it or not. So football, NFL football, players do not have to wear mouth guards if they don't want to, and you would think like as a spectator, like, wow, that's nuts. Like, how could these guys not go with mouth guards? Some of them do, like honestly. And so, basically my research, because I do a whole bunch of custom guards as well. I mean, we make them in-house. And so I've done thousands and thousands of these things over the years.
Mhm.
And, when I started looking at the research about, lab custom made mouth guards versus, boil and bite stock mouth guards you can find over the counter, there's not a ton of studies that show the difference between wearing a stock mouth guard versus a custom guard if they're worn and the injury rates. There's laboratory tests that say a custom guard's better if you have the certain thicknesses in the certain spots where it needs protection versus a boil and bite, because there's when you do a boil and bite at home, there is no quality control, right? It might be too thick, it might be too thin, that kind of stuff. But
Mhm.
the reality that I came to the conclusion is that a mouth guard that's worn is always going to be better than one that's not worn, period. And so I think that is the real reason why custom mouth guards, not only are they most protective in the laboratory, according to laboratory tests, but that players are going to wear them because they can speak with them, they're comfortable. They fit beyond just their teeth, and so you can't, almost like they're invisible. You can't even feel them, right?
Yeah.
Players, when they're wearing custom guards, I mean, we hollow out the insides where they don't need the thickness, and so they don't feel like they're having any breathing issues. I mean, there's all kinds of studies that show that properly made mouth guards do not impact VO2 or breathing at all. But the ones that are thick and bulky and stuff like that, players aren't going to want to wear them, right? Especially if they don't have to. And so, again, the mouth guard that's not being worn, those are the athletes that are more prone to injury. And again, I've been doing this for 17 years, and I think we talked about this earlier. Even with the players that don't wear mouth guards and the ones that are on the team that like them a little bit thinner than what we would typically recommend, I have yet to have any type of major dental injury of the 17 seasons I've been with the team. And these guys, like every single Sunday, are going out there and are the equivalent of car wrecks. And so there's a lot of trauma, and you would think that there would be more injuries. There just isn't, right? And so anyways, I think that's the biggest issue, is getting them to fit and be comfortable. Now, when you start talking about laboratories making them, the big push in dentistry, just anything, is AI, 3D, CAD CAM, all that type of stuff. And, for younger players, younger athletes, the biggest obstacle is going to be access. So getting to the dentist to actually have the molds made and the mouth guard made properly, and the
Yeah.
cost.
Yeah.
It's expensive to make mouth guards, especially when you have younger adolescents who are in mixed dentition. Their mouths are changing. And so a custom mouth guard by default is no longer custom next season. So they have to make a new one. And so that can add up over time. And so you know, how do you get past that? Or even like, players that are in orthodontics, for example, they have
Yeah.
brace metal wires and stuff like that. It's a challenge. And, I just don't think until we get to a point where we're actually able to really quickly make things using CAD CAM technology, maybe really cheap digital scanners in schools, for example, have machines that can print these things, like, AI design them, machine prints them, but also materials that we know are safe, right? So just because it's convenient and you're putting a resin in the mouth that they're chewing and it might be releasing all types of chemicals, we don't know what that's going to do to a young athlete over the long term. So yes, the technology is coming around, it's coming rapidly, but I do think that we need to be careful of how we progress with this.
The worn mouth guard is better than the one that is not. I think that is definitely the key takeaway. Even if it's a $50 boil and bite, could save you a lifetime of trauma and a heck of a lot of insurance money and bills in the long run for
Yeah.
anyone going through it. Um, would you say a lot of high performers, because they haven't optimized their oral health, are leaking performance? Like they're leaving performance on the field? Would you say that's a fair statement, or eh?
I think it's fair. I mean, in fact, I'll go a little further with that. I mean, I would say it's probably one of the biggest blind spots of performance today. Again, I don't want to be overselling what we're talking about, that we're going to make, a good athlete, a great athlete. That's not what we're saying.
Yeah.
But if you really kind of think about what you just said, this leaking performance, I mean, think of an IV drip into your bloodstream. That's effectively what periodontal disease is, if you think of it that way. And
Hmm.
so instead of like this dramatic injury, like a hamstring pull or an Achilles tear, it's just small little bite size, injuries that just sucking energy and performance and recovery out over time, right? And it's such a manageable, um, a manageable and modifiable source of inflammation that, it's really easy to fix in general. And so some of it's awareness. And that's what I'm working towards, is really trying to get the awareness that, hey, this could potentially be an issue. Let's put the studies in place. Real quick story that I like to share with you. When I started kind of getting into thinking about this, I have some assistant trainers that I work with the team for the last 17 years. We're really close friends. I trust them implicitly. And what I did last year is I put together a list of about 70 players that I have clinical data on, that I have radiographic data on. Totally, and I basically sent it to them. I said, here's a list of players. That was all. It was just their names. I said, put an X next to the names of players in the top of your mind you think had trouble getting back from injury. And
Hmm.
so these are not the, the normal recovery times, but the ones that, they'd have the hamstring pull and you think you get them right, and all of a sudden, boom, they pull their hamstring again, re-injure the same thing. Or, for whatever reason, they just didn't follow the same timelines of recovery that normal players do. So they happily took this task on, put the X's next to the name, sent it back to me. And then I took and I correlated to my clinical data. And it was really amazing. I mean, of the list of players that had a hard time getting back on the field, about of that group, they're 4 times more likely to have moderate to severe periodontal disease, 3 times as likely to have pericorditis or a past history of pericorditis, 2 times as likely to have root canals in their mouth somewhere. And it was kind of that started, this odyssey of sorts, right? I mean, it just was eye-opening. I mean, it's 70 players. It's not a huge number, but it's a big enough one to start seeing some trends that I thought worth exploring. And so that's kind of some of the things that we're sort of looking at behind the scenes. Again, I can't, delve into detail, certainly player data and stuff like
Of
that.
course, yeah.
But, and there's a lot of limitations, to be honest with you, just with the league about what we can test and what we can't test, through the Players Association and what have you. But again, if you just look at the mechanisms of how inflammation affects recovery, like I definitely think there's something there, and I'm looking forward to, kind of proving that down the road.
The sort of study, the in vitro study that she did, was it published like with obviously without any player names? Is there any way we can look at that data? Because that's so intriguing. I mean, you look at professional athletes in other sports, like a great example, whether obviously who knows if it was periodontal disease, but Conor McGregor with UFC just came back, injured
Mhm.
himself a minute into his fight, after being off for 5 years. And obviously there's a lot of factors there. But you look at all these other athletes coming off of out of retirement who injure themselves almost like clockwork in either the first week, second week back with some sort of injury, maybe not career ending. And you can't help but wonder why, what was happening there. And so that study to me is incredibly interesting. So if it's published somewhere and we can see it, I'd love to share that with the audience for sure.
Yeah. So it is not published, unfortunately. This is sort of just more internal data that's kind of with us right now. But to your point of the re-injury, there's some research that's being done overseas about something called the extracellular matrix. And so, cells reform, but they reform almost like a scaffolding, if you will. And so this whole idea of nitric oxide and blood flow and in recovery really has to do with that. And so some of the research that's being done is on oral health. I mean, I'm sorry, oral bacteria, especially this commensal bacteria that creates nitric oxide, looking at things like its impact on, HbA1c and insulin, control, like with muscles. And how does that actually get incorporated into the recovery process that's happening in anybody, not just athletes? And so I think there's a lot to do. Certainly, my small little questionnaire study, in-house study, like raises a lot of questions and definitely a lot of curiosity for sure. But I think we still need to work on, some more details and kind of work through the bureaucracy and the loopholes that are, part of the actual league. Because I do think they would be important. I think, teams would be certainly interested in finding more about this, players certainly as well. And so we'll see where it goes.
It's probably a good thing you didn't send me the study because as I put on my Seattle Seahawks hat, fan as defending champions, I would have sent that study almost immediately to Mike McDonald and his coaching staff for every little competitive edge we can to retain the Super Bowl title. So, but I really wish we could see that because that is truly fascinating for all levels, not just in professional football. That brings us to our wisdom bites, a section that we're pun intended, and it's no longer a working title. I'm going with that, whether everyone likes it or not. And so, four
Mhm.
questions for you off the top of your head. And the first one would be, what's one mistake that ended up teaching you something valuable? Could be dentistry, could be outside of dentistry that related to your professional career, but one mistake that taught you something valuable.
Let's see. Well, I will have to say, first of all, it's not a wisdom teeth thing. It actually has to do with dental implants. And so early on in my career, so we talked about my training in San Antonio. So early on, I was placing dental implants,
Mhm.
and I had this one patient where I placed an implant in a lower molar site, right? And so when you start placing implants, everyone kind of knows like this is probably one of the safest sites, the best bone. Um, so I had done that, and the patient came back and had an infection around the implant and end up losing the implant. So it was like, ah, crud, this happens like, 5 times out of 100. And so let's go ahead and graft it. We'll redo it again. So it came in again. We placed the implant again. Same, same result. And so now I'm like thinking, okay, I did everything by the book, right? I didn't overheat the bone, blah, 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 this and that. Like what could possibly be going on? And like for me, like as you probably can tell, like I just kind of curious, I question everything, right? So I started thinking like what else could be going on? And so it finally turns out that this particular patient was a diabetic, an uncontrolled diabetic. I didn't know that. She didn't know it either. And so it kind of came out a little bit later after we had the second failure. And it turns out that her blood sugar was impacting her ability to heal and deal with things like infection. And so, that was probably one of the earliest things that helped me start seeing not just teeth as teeth, but as part of the overall body. And so, all these things had to interact with each other.
Would you say that particular patient was sort of the jumping off point to you getting into wellness dentistry, however many years ago that was? Is that the one that was kind of like, whoa, hold on a minute, there's more here. Like it's not just teeth, it's everything else attached.
Yeah, yeah, I think that's probably part of it. I would say imaging. I'm a visual person, so once we started getting into 3D scanning and 3D imaging, like CBCTs and things of that nature, and really start to see things and start questioning why are things looking the way they are, all these things started kind of, revolving into this whole body, systemic health sort of philosophy that we carry now. Um, so I think is like little bits at a time,
Yeah.
honestly.
Yeah. Are you incorporating any kind of jaw motion tracking into your diagnosis as well too?
Not yet. Yeah, we've tested the Modjaw
Mhm.
specifically. It's an amazing machine. It's really cool. We have not yet gotten into that just yet.
Okay. Okay. Fair enough.
Yeah.
Speaking of technology, next question. What's something in dentistry you think we're getting wrong right now?
Well, I think that's easy, and it's kind of comes off of what we've just been talking about. But I feel like we still treat the mouth as separate from the body, and we treat dentistry as repair instead of prevention and performance. So this whole reactive approach that we as dentists been doing all along, like I think that needs to change. And so, um, I thankfully things are changing. We talked about the cardiologists and the orthopedics and how they're integrating, looking at the oral health before they start moving forward, and the salivary and the microscope diagnostics and the biologics that we use. And so if I'm doing surgery, I'll draw blood and I'll mix that up and use their own blood to supercharge your healing. We do low level laser therapy in our office, red light therapy. Just the whole notion of recognizing airway issues, because I do feel like a lot of our patients come into the office and many of their dental issues and other things like anxieties and stress and all that type of stuff actually has a lot to do with their sleep. And because, we're in such a prime position where we're looking in patients' mouth all the time, oftentimes we're the first ones that actually are able to, make the first, step in getting these patients well. And so I take that responsibility very, very strongly. But I do feel like that's probably the biggest issue is that, in general, dentistry is still separate from medicine, and we need to start changing that.
So how do we change that? What does that look like for you? Because that's a conversation I had with Dr. Amanda C. I've had it with a couple others as well too. And the people who get it, and it's not an issue. But I'm just going to go ahead and say that that's definitely not the norm these days. And there's sort of that funny joke of, you know, it doesn't end here. This isn't separate from the rest of the body. So
Mhm.
how do we start? How do we bridge, or how do we speed up that integration, that medical dental integration? What does that look like in your mind?
In my mind, I think it's communication. We need to get out there. We need to communicate, and especially in this stage of social media, like it really is
Hmm.
pretty easy to get the message out there. But it does still require, I think, a little bit of ground and pound where you go and visit offices, like show up face to face, that whole relationship thing that really needs to develop.
Hmm.
Um, and I think part of that communication has to be, some humility as well. It's like, listen, I don't know everything you know, but you don't know everything I know, but we do know together that we want the best for our patients. So let's see if we can kind of figure out how to do that. And so I think that's going to be the biggest thing is the communication awareness. And I do feel that it is finally making its way out there. I have lots of medical colleagues who are fully aware of what's going on in the mouth now. They ask me about it. They read about it online. They're, asking questions like, hey, is this really going on? What do you think about this? What do you think about that? So, especially the younger ones that aren't so set in their ways, they tend to be a little bit more open to some of these things. And um, so I think it's happening. I think the wave's coming. It's just a matter of time, but I do definitely think it's going to be communication.
And I think, obviously that starts with change in, new patient intake and consultation in the appointments as well too, is saying, asking for that medical data. I assume, just knowing a little bit about the background and the cohort that you work with as well too, that you probably ask for medical information in your new patient intake, aside from, the NFL, all that kind of stuff. But what does that look like? How has your experience been for a new patient, and maybe they've got a medical doctor who you have not met? How has that experience and interaction been for you?
Yeah, so I mean, I guess communication is kind of part of that as well. Having a new patient in, like a big part of learning about somebody is the patient interview. It's
Hmm.
not just them filling out a form, it's sitting down, having a full-on conversation, asking the right questions. What are they doing? For themselves, for their health. I mean, you'd be surprised where, a patient comes in and they think you just want to look at their teeth, but it turns out they're seeing a functional health doctor about A, B, and C. They're taking supplement X, Y, and Z. They're doing types of exercises. They're, weight loss, all this type of stuff because they want to feel better. They want to feel younger, look younger, all that kind of stuff, increase their confidence. And so, they're out there doing the stuff, but you don't know unless you ask a question. So I think that's the first part. The second part is like you kind of had discussed was, getting our hands on blood tests, asking patients like, hey, can I
Hmm.
get the most recent copy of your blood tests? Why does that matter? Like patients say, well, what do you need my blood test for? Well, back to the example of the implant that failed on me with that patient with the uncontrolled diabetes, I'd want to know that. Perhaps vitamin D levels are lower than we want to see. And I know that if we're growing bone and we want bone to grow around, an implant, we want those vitamin D levels to be optimized. So you can look at things like HSCRP and or neutrocyte neutrophil leukocyte ratios and kind of make some determinations. Is there some low grade inflammation going on? Where is this coming from? If it's not the mouth, is it somewhere else? Are they dehydrated? Are they not getting enough sleep? Are they stressed? Like, is there something else that might be happening behind the scenes? Maybe we need to refer them to a sleep physician or sleep specialist or a functional medicine. Could there be allergies and toxicity? There's so many different things that we need to kind of focus on. It actually makes it a little bit difficult, but having that data in front of you and asking those questions really goes a long way.
I probably would have answered the patient and just said, "Well, I'm going to cut into you and I'm going to drill into you and there will be blood. So it's kind of important for me to know what's going on." But that was a much more informed answer, and that's why I'm not the dentist. So, uh, next
Yeah,
question.
and a busy clinical day. That's how I respond.
Yeah, there you go. Yeah. Well, I'm going to cut you open. So, I mean, what do you expect? Uh, Next question. What outside of work makes you better at what you do?
Boy, it's a good question. Honestly, I'm going to go way back. So, an interesting fact that, you and our listeners don't know is I actually have an identical twin brother, and he's also a
Okay,
dentist.
hold on. Before you go
Yeah.
there, I need you
Um,
to prove that you're Chad and it's not your identical twin brother doing this interview for you. So you
it's
got to
not.
say now something that only you would know and not he would, and he would.
So truth be told, he's my best friend. We grew up together, but we did everything together growing up. So sports, he was kind of like my play buddy. If I wanted to go throw a football around, he was the one to do it. And so, out of that was born this huge competitiveness. And I would say that, I am super competitive. Always want to be the best that I can be at everything that I can be. And so, I would say, just having him and, the fact that we played a lot of sports and just all the different life lessons that you learn from playing sports, teamwork, dealing with losing and failure, just what putting effort is, putting that effort into something like which you can accomplish, the value of hard work, communication. We talked about that. I mean, all these different things that you can kind of get out of sports is something that I did with my brother. And so I feel like, those life lessons have traveled with me, basically up until today. And so I would say that probably is one of the biggest, the highest impact things that's happened to me is having an identical twin brother.
Nothing wrong with a little healthy competition. What's the main sport that what is his name?
His name's Brian.
Brian. What is the main sport that you and Brian compete at that you're the closest at that it's like the tally, the win marquee, it goes back and forth.
Well, so we used to play a lot of team sports together, baseball, basketball, soccer. But I would say we probably the ugliest battles that we ever had was on the racquetball court.
Okay, sure. Yeah, fair
Okay.
enough.
You can imagine how ugly that potentially got. So
And not necessarily unprone to facial damage with a racquetball as
that's
well,
correct.
too, from the ball, from the racket. Any horror stories you can share?
Giant welts on the back of my legs. It's pretty much
Okay, no facial trauma from
nothing,
ricochet.
nothing. Yeah, nothing facial, thankfully.
Okay, yeah, thankfully. Okay, good. Well, shout out Brian, and we're cheering for you, Chad, not Brian. Last question for the wisdom bites here. I'll give you a minute to think about this one. Maybe not a minute, but last one. What's one piece of advice you hope people carry with them after our conversation today?
Well, I'm going to jump right on the bandwagon again, but I'm basically going to say, I mean, really, I think that people should just stop thinking of your mouth as separate from the rest of your body. I mean, it's not a set of teeth that you just show up to the dentist to maintain. I mean, it's really, how should I say, it's a daily input into, your energy, your recovery, and how you show up every single day. And I think most people need to understand they need to take care of it like it's part of their performance because it is. And honestly, it's probably the cheapest, most overlooked edge that, you have sitting right underneath your nose, literally.
Love that. That's all the questions I have, talking points. But I have a few more. I mean, we would be remiss if we didn't mention some of the charitable work you're doing My guest next week is Dr. Katie Toe as well too, who you know quite well also. Tell me a little bit about the some of the charitable work you're involved with.
Well, Katie is an amazing friend, an amazing colleague, and just, I mean, absolutely inspiring person. So, anyone's ever had a chance to meet Katie, I mean, she really is, to me, the leader in the wellness dentistry field. And so, thankfully, she's invited me to speak at the Wellness Dentist Summit that we're going to be holding in this October. I spoke at her Wellness Dentist Summit down in Houston, Texas last December, and hopefully get an invite to speak again, which I think I might. And so, we've been doing a lot of that together, locally, like we do a lot of food for others. And, to my wife and I, like we recognize that hunger is a big issue, even in Fairfax, Virginia, where we have our practice. I mean, it's a very wealthy community, but there's surprisingly a lot of issues with hunger, especially amongst the youth. And so, we do all kinds of food drives every single year with our patients inside the office, outside the office, collect food for that as well. We also participate every year in the Mission of Mercy project. So we like to give back our dental skills and expertise for those that can't afford it or don't have
Mhm.
the wherewithal to be able to get some of those services. And so, we do something called the Mission of Mercy Project. We volunteer our time at the local dental society clinic here in Fairfax, and so we'll provide services to some of the needy patients as well. And so really just try to be part of the community and sort of give back in the same way that we've been graciously given all these gifts ourselves. And so.
Incredibly important, not only in
Mhm.
services, but in mentorship as well too. Where if our listeners want to engage with you directly, they want to pick your brain more about the sports performance and how you're incorporating that in your practice. What's the best way for them to engage with you directly?
For sure. So, I have two Instagram handles. One is Dr. Chad Kasperowski. That's Dr. Chad Kasperowski. And you see my name in my bio for this episode.
Mhm.
If you want to kind of just sort of see the everyday stuff that we're doing, talking about wellness, dentistry, that's probably where we'd want to go. If you want to get more kind of into the specifics of sports performance and oral inflammation, you can find me at the sports dentist, or I'm sorry, these performance dentist at Instagram. It's the performance dentist.
The performance dentist. Okay. And
Yep.
we'll throw those in the comments, or pardon me, in the comments and the description as well
Okay,
too
perfect.
when we post it up on YouTube and Spotify. So Dr. Kasperowski, thanks for your time. Incredibly important. Love the opportunity to get to pick the brain of a high performance
Yeah.
dentist. Uh, anything else? Any parting words? And if not, we'll I know it's approaching. Hey, we're talking about sleep, so it's almost bedtime on the East Coast for some of our listeners. Maybe you, I don't know, no judgment, but maybe you need a strong drink after tolerating me for an hour here. But any parting words before we sign off for the session?
Well, Robert, I just really appreciate you having me. And I really think what you guys are doing is sort of spreading the word, getting the awareness out for a lot of this wellness dentist stuff that we're doing is vitally important, just like we talked about in the episode. And so, again, thank you for having me and keep up the good work.
Thank you very much. And I really appreciate everyone taking the time this evening to join us. And I hope you found some guidance and join me on our next episode, as we mentioned, Dr. Katie Toe, next Tuesday, 6 p.m., right here on Zoom.
Yep.
Dr.
Don't miss
Kasperowski, don't miss it. Yeah. Dr.
it.
Kasperowski, thanks very much. Appreciate it. Have a great
Appreciate
evening, everyone.
you
Thank
do
you.
this. Thanks.
Bye.